facial makeover or face makeover of sorts. He desires work upon the middle third and lower third of the face. When I say lower third, it's basically to the chin. If you can turn to one side, sir, we see the chin here, the height is quite low or less, and also this chin has a bifid demarcation. This chin is split into two parts. So that has to be corrected. So it's like a cleft chin which will be corrected. Also the angle, if you see, he doesn't want this protruding to the side, so he wants this part to go inside and to form a proper V shape or mantle. Just turn this side, sir, similar concept, and he wants this angle to go inside. Also very prominent part of his face happens to be his cheekbones or the mandible. So we see very prominent mandibles. If you can look up from this view, you can appreciate more. So all osteoclasts been designed to give the correct proportion to his face. That is, when we see the bigonial, that is the angle to angle of the mandible, and the bizygomatic width. So that has to be proportional in this case. Also with respect to the nose, if we see the patient is designed a very narrow dorsum and a sharper tip, much sharper than what he has right now. So it's going to be a face makeover of sorts for him. We'll be starting the surgery and we'll follow it up before leaving the leaves for the center. Thank you.
मुंह खोल कर सांस लेना आप. एवढं तरी मस्त आहे.
Pressure.
कट பண்ணு. கொடுத்துரு.
But you can see the difference. Production of a face that has less balance between the height and the breadth. So we've augmented that. What do we do? Oh, karo. Bite karo, bite karo. It's fine. Nothing has to be done. He just has to be on medication. देखो सूजन है, जब बहुत सर्जरी होता है ना तो थोड़ा सूजन रहता है, सब धीरे धीरे कम होगा. डॉक्टर को डाउट था, इसीलिए मुझे देखने के लिए बताया. कुछ नहीं करना, आप जा सकते हैं रूम पे. Indurated a lot everywhere, so there should be some hematoma inside. That will take some time for resolution. But that'll be fine. So you can just. So we did a major face makeover for this gentleman, and I'm just telling them that he has induration, meaning there's some blood that's come inside and it's not yet totally clear. We've removed some of the bandages for him, but you can see there's a lot of swelling here. It's thick, it's firm. We call it indurated. So we just want to put him on some more medications to reduce his swelling. It's probably going to take a few more days. इसका भी तब निकालेंगे 2 दिन के बाद. आपको थोड़ा वेट करेंगे, ठीक है ना? All right, thank you. Right, just shift him in.
Alright, so here we are with a patient who has been with us for almost 10 days after a face makeover surgery. Now I call this a face makeover surgery because multiple facial surgeries have been performed for this patient by Dr. Richardson. So first we will start with the splint removal, which is placed because we have performed a rhinoplasty for him. थोड़ा सा दर्द होगा. So this splint is kept in position for a period of at least 7 to 8 days. But since he had multiple facial surgeries, as I mentioned earlier, the splint was kept longer. Alright, so we've done a rhinoplasty, malar bone contouring, then genioplasty, angle osteoplasty. So these are the 4 procedures. You see these sutures at the alar base where we've done alar base reduction, or what we call a alar plasty. आपको अभी भी सूजन है. All this bruising is because the radix osteotomy that was performed. आँख थोड़ा लाल है, वो 1 हफ्ते में ठीक हो जाएगा. ये हाँ पेन कम हो गया है. पेन आपको कितना था सर्जरी के बाद? फर्स्ट डे था, उसके बाद ओनली फर्स्ट नाइट था, उसके बाद कम हो गया. Okay, that's good. But you had a lot of swelling. Now it's still there. Still you have a lot of swelling even now. So these kind of bony, all the work that has been done involves the bone. It takes a lot of time, maybe a period of 1 or 2 months for the entire swelling to resolve, because everywhere the bony work has been done on the chin, on the nose, on the cheek, which is the main reason for the facial swelling, also the angle region. Now coming to why he has got this surgery done is because if you see on the right side, he had facial asymmetry, especially this angle region and the malar region. His nose tip is quite bulbous and he had a very broad nose. But now what you see, we have done a dorsal width reduction, and the swelling at the tip still exists. We have done an alar base reduction. You can see the nostril show, which is there. Smile karo. Okay, आप अभी खाना खा रहे हो नॉर्मल? Soft diet? Only liquid and soup. Today onwards you can start soft diet. ठीक है? So generally we keep the patients on a liquid diet for 5 days, but since he had so many multiple procedures and he wanted to be extra cautious, he stayed with us longer even, and today is heading home, and today onwards you can eat soft diet. Alright, now I'll take off these sutures. We clean everything up so that you can have a better look. 1 महीने तक आपको कोई भी exercise, no gymming, no swimming, nothing, no yoga, nothing you have to do. After 1 month you can start.
जो प्लेट है इसको एक और
रिमूव कराने की ज़रूरत नहीं है ये, क्योंकि ये टाइटेनियम प्लेट्स है, ये बायो कंपैटिबल है. इन्फेक्शन होने का चांस बहुत ही कम है, लाखों में 1 को हो सकता है, पर बहुत कम चांस है.
जैसे मेरे ओपन पोर्स है, अगर
क्या है
ओपन पोर्स, अगर उसका ट्रीटमेंट कराओ तो उस टाइटेनियम प्लेट से कुछ दिक्कत नहीं होगा? जैसे कुछ लेज़र वाला कुछ होता है?
नहीं, कुछ नहीं होगा. So these are common questions that patients ask us, whether the plates need to be removed. No, they need not be removed, but however if patient wants them to be removed, we can remove it after a period of 4 to 6 months after complete bony healing has taken place. So now we wish you all the best. Do send us your post-op pictures follow-up number पे, and आपका swelling कम होने पे एक हर 2 हफ्ते बाद हमको फ़ोटो भेजिएगा. आपको वापस आने की ज़रूरत नहीं है. ओके.